So let's look at where the new human coronavirus came from. That's the question we want to ask. We don't yet have an answer for that, but we can look at the related viruses. So let's look at the SARS coronavirus. So the coronaviruses, I should say, they are RNA viruses, and they're very well known for their ability to jump between different species. So both SARS coronavirus and the MERS coronavirus are examples of coronaviruses that recently jumped from animals to human population. Now, the keen-eyed amongst you, when I showed you that slide before with the list of coronaviruses, you would have seen bat repeated several times. This is because bats harbor the greatest diversity of coronaviruses, and I just thought that all coronaviruses originally came from bats. So SARS now is believed to have emerged from a bat called a horseshoe bat. It moved from that in about 2002. There was a cross-species transmission into palm, civet cats, and other animals in the live markets in China. And then from there, it moved into the human population. And this type of jump, it was a rare jump, but it occurred. And that would be the zoonotic transmission. Once it was in the human population, it could then spread from, it then acquired the ability to spread from human to human, out in the public or within a hospital setting. MERS now is a little different. MERS is thought to have emerged from bats, crossed from bats into camels more than about 30 years ago. And then you got transmission from the camel populations into humans within the Arabian Peninsula, where there are lots of camels. And then the thing about the MERS coronavirus now, it often jumps from the camels into humans, but it doesn't very often go from human to human. It can, but it doesn't often do that. So the MERS spread was more restricted to the Arabian Peninsula where the camels were. So what about our new virus now, the novel 2019 novel coronavirus? As I said, the origin of this virus is still unclear. However, analysis of the virus's genetic material, which is illustrated here by this sort of family tree of viruses, indicates this is one of the novel coronaviruses here. And you can see that it's closely related to other bat viruses, and you can see SARS is also nearby. So it is likely, given the relationship, it is likely that like SARS, it originated in bats, but this remains to be confirmed. What we also do not know is whether it came from bats and went directly from bats to humans, if it went from bats into animals in the live market, specific type of animal or several animals in the types of animals in the live market, and then to humans, or if there's some other reservoir out there that we don't know about, animal reservoir that we don't know about. Now, there was one report that spread quite widely about suggesting that snakes were an intermediary, that this virus had gone from bats to snakes to humans. But in fact, there's no convincing evidence that snakes are an intermediary. Okay, so whatever the origin, based on the analysis of the virus's genetic material, it is estimated that all the viruses that are currently circulating in humans, the novel coronaviruses circulating in humans, descended from a single introduction into the human population, or if it wasn't a single introduction, it was a small number of animal to human transmissions of very, very similar viruses. And they've also estimated that this occurred in November or early December. So we saw the first cases in mid-December, but this transmission could have probably occurred before that. Right. So the virus is now in the human population, and it is now clear that it can also spread from human to human, since the majority of new cases that have been recorded have no history of exposure to the market that was suspected to be the source of the virus. And there have also been cases of healthcare workers caring for patients with the virus who have contracted the infection.